Right now, we're seeing an absolutely monumental shift happening in women's health. Now, on the surface, you might think, oh, it's just a matter of semantics. But when you really dig into it, it's fundamentally about scientific accuracy, patient advocacy, and correcting literally decades of medical misunderstanding. We're talking about the condition formerly known as PCOS, and why changing its name is arguably one of the most important medical updates of our time. 170 million. That's the estimated number of women globally affected by a condition you likely know as Polycystic Ovary Syndrome, or PCOS. It impacts roughly 1 in 8 women during their reproductive years. But the core issue, the thing that has frustrated patients and doctors alike for years, is that we've been calling this incredibly common condition by the completely wrong name. So think about it. What actually happens when a health condition affecting hundreds of millions of people is totally misnamed? Well, it leads to confusion, fear, and deeply fragmented care. In this explainer, we're going to unravel the mystery behind this misnomer. We'll discover exactly how a massive, unprecedented global effort is finally correcting a historic medical error, and what this new era of accuracy really means for patients worldwide.
Part 1. The problem with PCOS.
For decades, PCOS has been a household name. But there is a glaring contradiction between what that name implies and the actual biological reality. The name literally tells patients they have pathological ovarian cysts. But the reality? There's absolutely no increased risk of pathological cysts with this condition. The cysts are actually just small arrested follicles. Because of this highly misleading name, patients are conditioned to fear an isolated gynecological issue, while the actual multisystem metabolic disorder completely flies under the radar. And this massive gap in understanding leaves up to 70% of affected individuals totally undiagnosed. The evidence-based case for a new name reveals some pretty severe real-world consequences: significantly delayed diagnoses, immense patient dissatisfaction, and a deeply rooted sociocultural stigma surrounding fertility. The narrow reproductive focus of the word ovary complicates how health systems code the disease, it fragments research funding, and honestly, it creates a massive barrier to effective communication between patients and their healthcare providers. Part 2. More than just ovaries. To truly grasp why a name change was so desperately needed, we have to look way past the reproductive system. You see, this condition is deeply rooted in the endocrine system. It's characterized by hyperandrogenism, meaning elevated androgens, or male-type hormones. And these elevated hormones drive intense systemic disruptions, causing distressing symptoms like severe acne, alopecia, hirsutism, and systemic low-grade inflammation. The central neuroendocrine abnormalities actually throw off the way the entire body secretes hormones. It also heavily impacts metabolism. Insulin resistance is present in a staggering 85% of affected individuals. And get this, that includes 75% of those who are considered lean. This intrinsic metabolic dysfunction drastically ramps up the risk for impaired glucose tolerance, type 2 diabetes, and cardiovascular disease. In fact, research shows that the odds of a myocardial infarction, a heart attack, are 2.5 times higher in these patients. So, the fundamental takeaway here: this is a polygenic, multi-system disorder. It involves genetics, the endocrine system, and metabolism all at once. It is absolutely not an isolated ovarian issue. The old name, PCOS, simply had to go because it entirely failed to capture the scientific and biological reality of the patients actually living with it. Part 3. A global mandate for change. Realizing this profound inaccuracy, the medical community sparked an unprecedented movement. And this wasn't just a few doctors sitting in a closed boardroom. This was a democratic, worldwide mandate engaging 56 leading academic, clinical, and patient organizations. They gathered an incredible 14,360 survey responses from both patients and professionals across 104 countries. And because it was co-designed with patients who have lived experience, there emerged an overwhelming, undeniable mandate demanding scientific accuracy. They didn't just pick a new name out of a hat either. They followed an incredibly rigorous, structured process. It kicked off with iterative global Delphi surveys to gather thousands of diverse opinions. Then they moved into intense nominal group technique workshops, bringing together patients and multidisciplinary experts to really debate the terminology. Finally, they even brought in branding and implementation experts to ensure the new name would actually function in the real world. The core principles derived from these workshops set incredibly strict criteria: scientific and medical accuracy, total clarity, and the strict avoidance of cultural stigma were absolute non-negotiables. The new identity had to facilitate better clinical care, while also being culturally and linguistically appropriate all across the globe.
Part 4, Introducing the Solution.
After navigating all those cultural sensitivities and biological realities, a fierce debate centered around how to accurately describe the reproductive aspect of the disorder. The term reproductive was accurate, sure, but it carried a super high cultural stigma regarding fertility. Ovulatory was less stigmatizing, but felt incomplete, especially for postmenopausal women. Ultimately, the term ovarian triumphed. Why? Because it accurately encompassed the endocrine and follicular disturbances without carrying the intense fertility stigma of the other options.
The data clearly backs this up. In the final global workshops, ovarian was the decisive winner, capturing 70% of the support among both health professionals and patients. It easily beat out ovary and ovulatory, striking the absolute perfect balance between scientific accuracy and patient comfort. And so here is the big reveal. The condition formerly known as Polycystic Ovary Syndrome is now officially named Polyendocrine Metabolic Ovarian Syndrome, PMOS for short. Polyendocrine highlights the systemic hormonal disruption, metabolic captures the insulin resistance and cardiometabolic risks, and ovarian accurately identifies the specific site of the follicular and steroidogenic dysfunction.
Part 5. Why the new name matters. So why does this semantic shift actually matter for those 170 million women? PMOS matters because it completely transforms patient care. By removing that misleading focus on cysts, it immediately reduces patient anxiety. It finally validates the systemic, metabolic, and endocrine reality that patients experience every single day, proving it's not just in their heads. Crucially, transitioning from PCOS to PMOS allows for an evolutionary rebranding. It's close enough to the old acronym to avoid total chaos, but different enough to force an essential update in global research funding and health system coding. To ensure this isn't just some academic exercise that gets forgotten, an 8-stage global implementation roadmap is already well underway. It features a managed 3-year transition period. During this time, they'll be developing multilingual resources, integrating the new term into electronic health records and the World Health Organization's disease classification systems, and ultimately locking PMOS into the 2028 update of the international guidelines used in 195 countries.
Honestly, it's an incredible triumph of patient advocacy and global medical consensus. We are finally moving away from a historical misnomer that caused widespread harm and stepping into a future of accurate, empowered healthcare. This paves the way for much better diagnoses, targeted treatment, and ultimately real respect for patients.
With the focus now properly shifted to the metabolic and endocrine roots of the syndrome, the door is wide open for massive advancements in treatment. But the real question is this: how quickly will global healthcare systems adopt PMOS to finally give these 170 million women the accurate care they deserve? Thank you for joining me on this explainer. Keep learning, and I'll catch you next time.